everyone, I'm Shanon McQuitty with the Arthritis Patient Advisory Board at Arthritis Research Canada. Welcome to session number 3 with Dr. Jackie Whittaker, who is an assistant professor in the Department of Physical Therapy at UBC, research scientist of musculoskeletal rehabilitation. And firstly, I want to welcome you to BC.
Thank you.
Jackie has just relocated here, so we're very excited that we were able to steal her away. So could you tell everybody how you are involved in rheumatology and what your specialty is?
So I always find it a little hard when people say that, because I don't often think of what I do as rheumatology. But I do. I think that probably the word I would use is prevention. So my research is primarily focused on trying to prevent osteoarthritis. And primarily what I do is I work with young individuals that have hurt their knee, because the knees are the main place that one gets osteoarthritis. I think about 80% of osteoarthritis occurs in the knee. And I work with young individuals that have hurt their knee, usually during sport or recreation.
Like how young have you seen?
So the people that I work with, generally some of our first studies, they were as young as 9 when they hurt their knee, and as old as 18. And some of the work we're doing now is kind of 15 to 23. So typically not people that you think about when you think about osteoarthritis.
Yes.
You might think about that age group if you're thinking about juvenile idiopathic arthritis, but not typically the age we think of with osteoarthritis. So they don't have osteoarthritis, but they have a very important risk factor for osteoarthritis, which is a knee injury. And we know that about 50% of them will go on to develop osteoarthritis.
So I was just going to ask you, what's the risk factor?
Yeah, so somewhere around 50%, 7 times increased odds compared to somebody who hasn't had an injury. Mm-hmm. And the real kicker is that they'll develop it within probably 10 years. So we, in some of our first cohort studies, have actually shown individuals that are in their early 20s with radiographic symptomatic osteoarthritis. And again, that's not typically an age that you think of somebody that has osteoarthritis. And as we see an increase in the number of youth sport-related knee injuries, I suspect that we will also start to see larger numbers of younger adults that have the disease as well. So yes, rheumatology, it is definitely, it's about prevention, but it's typically, I think I always feel like I'm on the fringe, because I don't think I typically fall, within what you would normally think of when you think of rheumatology and rheumatological patients.
So my next question is, how do you reach that audience? Because that's an audience that's usually, their primary care is their parents, their first line is their parents. So how do you get that information for prevention out to that group?
Yeah, so it's interesting, and I think a lot of our work so far has just been figuring out what might differentiate a child who goes on to develop osteoarthritis versus somebody who doesn't, who's had an injury. And then based on that, we're working towards developing different ways we could intervene with that group. But to be able to do that, we definitely have to raise the awareness that this is a possibility in this population, to try to get people that are involved. So surprisingly, if you're a young female athlete, and in Canada the number 1 sport that young females play is soccer, followed by hockey or basketball, chances are you've heard about the anterior cruciate ligament, and you've heard about an anterior cruciate ligament tear, because it's an injury that's rampant in those sports and in that population. So believe it or not, a lot of them
just say ACL,
yeah,
right?
Sure, ACL, absolutely. They may not know it's anterior cruciate, the ACL. So a lot of them know about it because it's rampant, and I would actually say it's sort of part of the culture of young female sport around the world, ACL tears. And most of the young girls that have had an ACL tear will know in the back of their mind that they've got an increased risk for some problems down the road, and some of them might use the word osteoarthritis, some might think of it in a different way, but a lot of them already are aware, I guess, that there's a risk. But they kind of, as we all do when we're adolescents, we put that in the back of our head and we go, well, that's going to happen to me when I'm old and I don't have to worry about it now. And so I think a part that we work on around the awareness is getting them to understand that actually we're maybe talking 10 years, and that we've got this window of opportunity between now and then to really do something. And so it's reaching out to them through their sport organizations, it's reaching out to them online, it's reaching out to them through their parents, through physicians, through their physiotherapists. A lot of them will receive care for their injury, but that care typically is about just getting their symptoms down, getting their initial injury sorted out, and getting them back to sport or getting them back being physically active. And we don't always sort of tag on or add that extra piece, which is, well, what do you really need to be focusing on so you're less likely to develop osteoarthritis
Which
down
is
the
where
road.
the data gathering and narrowing it down in the work that you're doing, so that you can disseminate that to those patients.
Yeah. And we don't have all the answers. That's the tough thing is, we know a few things. And we know that, if people gain adiposity, they're more likely to develop the disease.
What's adiposity?
Fat tissue.
Okay.
Okay, so if they gain fat tissue, it's not about just becoming heavier or about having greater weight. It's about actually having adipose tissue, fat tissue, because there's a microinflammation component to that, which can feed into the mechanism for the disease. So we want these kids, after they've had an injury, not to gain fat tissue. We want them not to become inactive. And we also have got pretty good evidence to suggest that if their muscles are weak and they stay weak, they're more likely to develop the disease as well. So we don't have all the answers, but we know that those are 3 targets that if we can get these young individuals staying on top of, perhaps we can have some impact.
What's the first line of activity or prevention that parents can ensure that children are taking to avoid even having those initial injuries that could lead to the early onset?
Yeah, that's a great question. That's the killer, isn't it? If we can prevent the injury, the rest of it may never happen.
Yeah.
And so we've got really, really strong evidence that injury prevention programs, so neuromuscular training programs or warm-up programs that are performed as part of the warm-up to soccer or basketball or rugby, can reduce the incidence, the frequency at which people hurt their knees and their ankles by about 50 to 60%. We've got really good evidence from, synthesized at a very high level from multiple countries and multiple sports around the world to show that we can have an effect in reducing the number of injuries. The key now, as you can imagine, is implementing it so that coaches at all levels of sport and parents that are coaching at all levels of sport are actually teaching children to do this prior to playing to reduce the risk. And that work is it's being led by a lot of groups, but there's a group in Calgary in particular at the Sport Injury Prevention Research Center, where I spent a bit of my training time with, that really are leading a lot of that work.
Yay, Canada.
Yay, Canada. No, absolutely. We definitely have an international presence when it comes to sport injury prevention.
Okay.
We're known for that, as are
Excellent.
Centers in Scandinavia and Australia as well.
And there's a lot of, I think people aren't aware, but, and I believe one of the projects you're working on is an international project. So the people aren't in their country silos. They're not isolated in their countries. They actually work together with research. Yeah.
You can imagine there's a lot of research questions.
Yes.
And, I think there maybe was a time in some research fields where people will hold their knowledge and they don't share it because they're trying to be the group that discovers the next thing. But I think when it comes to injury prevention, disease prevention, I would say medical research, rehab research in general, there's so many questions and there's so much work to do that I think that we've decided, as an international community, that we need to work with each other so that we're not all asking the same questions, that we are actually all working on different aspects of the questions. And the reality of it is some groups have more expertise or knowledge or resources in a certain area, and it makes more sense for them to tackle certain questions. And then there's other areas, other groups of people that have those resources in other places. So there's a lot of playing in the sandbox together for sure.
And what are you looking most forward to taking away from this conference?
You know what? I think just seeing that maybe prevention's got a little bit of a spot on the agenda, and I've been involved with numerous groups around the world, and ORSI, the Osteoarthritis Research Society International. I go to that conference every year, and it was just literally 2 years ago in Liverpool. We had our very first plenary and session on prevention. So I do think it's on a lot of people's minds, but there's still so much going on when it comes to the care of the disease and the patients with the disease that we don't often get on the agenda, but it's slowly starting to happen.
I think there's a possibly, and being a patient, you assume that all this research has been done. Like, how could this question not be answered? How can they not know already? It's 2020.
Yeah.
But there's only so much manpower and brain power.
There is, and prevention's hard too, because if you think about it, somebody has a knee injury, they don't develop the disease for 10 to 15 years. So who's going to fund a study that's 15 years long?
Yes.
And that's assuming we got all the participants for the study in the first year,
Right.
and then we were able to follow them for 15 years. I mean, that's just, and I think that's why the work hasn't been done, because it's not easy to design those studies, and so we often look to data sets that exist in military cohorts and stuff where they might have done baseline testing when people came into the military, and then we can look at when they got injured, and then we can look at maybe where they're at right now health-wise. And so I think some of the work around prevention, particularly with osteoarthritis, is lacking because it's hard to design the studies to answer the questions.
And the answers could be very simple. We just don't have the proof yet.
Right. But we know that weight adiposity increases the risk. We know that injury increases the risk. We know that muscle weakness increases the risk. And so I think if you take that and you think, okay, at a bare minimum, what could I be doing? Those would be 3 really key messages.
And well, I have to thank you for getting involved in this.
No worries.
And I heard an interview that you did that I shared widely. I was so impressed by. So we're very thankful that you're here in BC with us now.
Yeah, I'm happy to.
At the CRA-HPA Arthritis Health Professional Association and Canadian Rheumatology annual meeting in Victoria this year. Do we have any questions from the audience, Anita?
Yeah, they wanted to know what are the link to the resources for injury prevention.
So probably if you Google the 11 Plus, that would give you access to a ton of YouTube videos on the various exercise and sizes and potentially some old manuals. So I'm pretty sure if you Google that, that will be one place you'll find those resources. I also think if you go to the Sport Injury Prevention Center at the University of Calgary, their website, you may also be able to access some resources there.
Well, thank you so much, Jackie, and enjoy the rest of the conference.
Yeah, perfect.
Great.
Thank you. Thanks so much.